Welcome back to Hey Baby and Beyond. I'm Lauren, an antenatal and postnatal teacher here in the UK. I'm here today to share with you some tips about inducing labour and what is induction of labour. So anything that we do that can bring on labour or make it go quicker is classed as an induction of labour. There are many different options for induction of labour and not a one-size-fits-all method will work. So often you might see one method or a few methods, or you might kind of see just something that happens during your labour. So it's not always to induce labour. Sometimes it can be used to augmentate labour during a labour process. So we have different ways. So starting labour off is classed as an induction of labour. Augmentation of labour is something that happens during your labour process to make things quicker. So there are many options to think about when inducing labour, and often this will be discussed with you at your appointments and maybe once you get admitted to hospital for your induction. What the midwife is first going to do is monitor your baby for around an hour and then give you a vaginal examination where the midwife can see how your cervix is looking, and this is called a Bishop's score. And what we're going to do is we're going to look at the consistency of the cervix, see if it's made any changes, and see if there's any cervical dilation already started. From this score, the idea is that the higher the score, the more favourable your cervix might be for the induction of labour. But this is not kind of a definite. So after this examination, they're going to decide what method to use, and once the method's decided, they would do that and then they would monitor the baby again for about another hour. After that monitoring, if everything's okay and your baby's not been affected by what's been done, it would be a case of you're mobilising and walking around, maybe going off the ward if you're a low risk pregnancy, and just staying as active as you can possibly be. So there are different methods of induction of labour, and it's important that you know what they are and where they might be used and how it might change your labour pathway. So the first thing that you might be offered is a sweep of the membranes, or a membrane sweep, or a stretch and sweep, it's sometimes known as. Now what this does is, the idea is that we're creating a space in between the membranes and the cervix by your midwife or doctor placing a gloved finger inside the cervix and rubbing the finger around those membranes in order to create a hormone release which might create you to go into labour. Now, the sweep is something that, although it is augmentating labour and we're hoping that it will begin, it isn't something that's going to set you off on the labour pathway. So you could choose to have a sweep at 39 or 40 weeks pregnant, but then not choose to be induced. So it's something that you can try and not kind of be formally induced due to having the sweep. So the sweep is optional. Some people choose to have them, some people don't. And the risks of having a sweep are that the midwife or doctor may accidentally break your waters. Now, that's not the aim. The aim is not to break your waters, because we know once your waters break, we're on a timer for kind of a formal induction of labour. So that's something that you might come across at first. The second thing that you might come across is something called a balloon catheter. And a balloon catheter is something where it's placed inside the cervix, and once it's placed in, there are two balloons, and what happens is the two balloons are inflated with saline, and what they do is they rub on the cervix to hopefully create the production of hormones. The idea with this is that when that balloon falls out, then your cervix is around 3 centimetres. Now, some people like this method because it's a mechanical method of induction, so there's no hormones included in that, it's purely mechanical. So some people will choose to go home with this in, other people will have it done in the hospital. It's normally left in around 12 hours, and after 12 hours, if it's not fell out, then they would reassess the situation and see where you're up to. So that sometimes works for some people. They might have 2 balloons put in and then it might work. The next process after that would be to break your waters usually and put you on a hormone drip. So you would be on the labour ward setting for this, but sometimes people like it because it misses out the first part. It gets you into that kind of what's known as established labour, the 3 centimetre mark. The next thing that you might see is a pessary or a prostin, and what that is, it's a small tampon-like tablet that is placed into the cervix, and what that does is it releases over time, and it releases the drug that softens the cervix, similar to the natural hormone release. Now with this, there's 2 different ones. There's one that's a slow release and one that's a long release. And what happens is the slow release ones are usually around 6 hours and will be done in the hospital setting. And the slow release ones would be done sometimes in a home setting. So you can go home with these in sometimes. They're on a string, so if there was any overstimulation of the cervix, that can be removed and it would be kind of taken out and it should stop. So with this, it's a method that we know does work, but often not just one. So you often might need 1, 2, 3 pessaries to get the process going. Remembering that anything that we do with induction is getting rid of the cervix. So we've got a lot of work to do before we actually start the labour process, which is why inductions can take a little bit longer. So after the pessary, if everything's straightforward and you've not required any other treatment during that induction, then you might still be able to go to a birth centre, but otherwise it would be to the labour ward to continue with your labour. The next thing that you might see is the syntocin drip, which is like known as the hormone drip. And what that does is that speeds up labour. So it can be used in different situations. It can be used when you're in labour already and not through induction, just to speed things up and speed your contractions up. It can also be used when you're in labour and if things slow down near the end, near the pushing phase. But in induction, it can be used alongside other methods. So it can be used after a pessary. It can be used after the balloon. It can be used for many different things. Remembering that when people turn the hormone drip on and have that going through the labour, it can speed things up and it can strengthen the contractions. That's the aim of it. So what we want is we want those contractions to become stronger and longer, and that's what that hormone drip does. Unlike oxytocin, it doesn't cross the brain barrier, so you don't get the feel-good hormone with that. So you do need to really knuckle down and kind of focus on your pain relief options when using the oxytocin drip. This has to stay on throughout the labour, because if we was to turn it down, the contractions would become not as strong as they need to be for the point of labour you're at. So that's another thing to think about when you have that. And sometimes your waters might be broken. So artificial rupture of membranes is sometimes offered during the labour process if things need to speed up or your waters are what we call bulging, and the midwife offers you to break them. And sometimes it can be done as part of the induction process. So if you've had the balloon catheter in, that's the next step usually. If they can feel your waters, they would break them, because that normally gives a huge hormone rush and everything starts to move along. So they are the different options for induction of labour. You might see one, you might see them all. Remember, it is always your choice, but induction of labour is there for a very good reason. It does things, it works, it's just the time process. So understand how long it might take, and that will all, first of all, give you that kind of knowing that it's not going to be a quick thing, but working with it and knowing what each thing is and knowing how it might change your pathway of labour can help you have a more positive experience. So induction of labour is about 1 in 3 in Manchester and about 1 in 5 in the UK. So it is something you might come across and it's worth knowing about. So I do hope you found that useful. Please do like the video. Comment below if you've had an induction of labour and what worked for you. Ask any questions that you might want to ask. And do remember to subscribe to the channel, because new videos are going to be coming on daily. Thank you.